Good afternoon. In compliance with Chapter 551 of the Open Meetings Act, of the Texas Government Code, I call to order a special meeting of the Board of Trustees of the Austin Independent School District for Monday, July 26, 2021 at 5:08 p.m. The board is meeting virtually through Zoom, and this meeting is streaming live on AISD TV and Apple TV. It's also being broadcast on cable channel 22 through Spectrum Grande, Google Fiber TV, and on channel 99 through AT&T Uverse. Closed captioning in English is available on these platforms for the hearing impaired. And to our audience tuning in remotely, welcome and thank you for joining us. We will move to the approval of the agenda. Secretary Singh, do you have a motion to approve the agenda?
So moved.
Is there a second?
Second.
Oh, sorry, that was a tie. Who was that again? Letitia?
Trustee Anderson.
Having a motion by Secretary Singh and a second by Trustee Anderson to approve the agenda. All those in favor, please raise your right hand. And the motion passes by all those on the dais. Secretary Singh, will you please lead us in the Pledge of Allegiance and the pledge to the Texas flag?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you. Next is an opportunity for the public to share comments with the board. We have time for up to 60 speakers. And as a reminder, the district continues to provide time during the regular voting meetings of the board to hear from the public about agenda items for consideration and vote. This is an opportunity for the board to take part in active listening. While we wish we could respond or provide feedback, we're required to limit our questions to requests for clarification or follow-up directly to the administration. In order to accommodate our video conference format, members of the public wishing to participate in the public comment portion of our meeting called the dedicated AISD phone line in advance of the meeting and audio recorded their remarks. We want to remind the public that this is just one way to allow you to share your thoughts and feedback with the board. The community can also email the board and superintendent by sending a message to trustees@austinISD.org. We will now play those recordings, so please listen carefully.
Hello, my name is Hallie, and I am an AISD parent calling about agenda item 4.1. I am calling today to remind AISD of their primary duty to educate. You are not medical professionals, and you are not my child's parent. You exist to teach children. By May 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Prioritize children over the union demands. My child, my choice. Thank you.
Agenda item 4.1. My name is Lisa, and I am an AISD parent. I'm calling today to remind AISD of its primary duty to educate children. AISD is not a medical professional, nor my child's parent. AISD exists to teach children. Parents, not AISD, are responsible for the health of their children. Parents should be able to choose if they mask their children, if they will choose vaccination. Public education is not dependent upon choosing either one. I support AISD's updated COVID protocols that are aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Please prioritize children and their education. Thank you.
Hello, my name is Martha, and I'm a concerned parent of the two AISD children. I'm calling today to remind AISD of their primary duty to educate. AISD is not medical professionals and are not my children's parent. You exist and are here to help teach our children. By May 2021, there are 1.2 million Texan students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our children and if we vaccinate our child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in Texas public schools. Prioritize children over the teachers' unions' demands. My child, my choice. Thank you.
Hello, my name is Karen, and I am a concerned member of the AISD community. I'm calling today to remind AISD of their primary duty to educate. You are not medical professionals, and you are not my child's parent. You are here to teach our children. By May 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Prioritize children over the union demands. Please, my child, my choice. Thank you.
Hi, my name is Jennifer Murchison. I have 3 children in the AISD system, and I am concerned about the AISD community. I am calling to remind you guys that your primary duty is to educate. You are not my medical professional, and you are not my child's parent. You exist to teach my children. Parents are responsible for the health of their children. We will choose if our children need to wear a mask, and we will choose if we vaccinate our children. Public education is not dependent upon one or the other. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Please prioritize our children over the union demands. It's my child, my choice, and I will choose if he wears a mask or not. Thank you.
Hello, I am a concerned parent of the AISD community calling about agenda item 4.1. I am calling today to remind AISD of their primary duty to educate. You are not medical professionals, and you are not my child's parent. You exist to teach children. By May 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Prioritize children over the union demands. My child, my choice. Thank you.
My name is Julia Ross. I'm an AISD parent of 2 elementary school students in 78745. I'm speaking today to the topic of COVID-19 safety and reopening. Public education is one of my biggest values as a professional and as a mom, and it is breaking my heart that we might not be able to participate in attending our neighborhood Title I AISD elementary school this fall, not because we're choosing not to, but because safe options are not available to prevent the risk of my children getting COVID until they're old enough to be vaccinated. I really hope that AISD will consider all options to offer either virtual instruction or designated masked classrooms parents can opt into until a vaccine is available to protect our youngest students. Thank you.
Hello, my name is Jennifer. I'm a parent of 2 AISD children. I'm calling today just to remind you during this board meeting, your primary duty is to educate. You are not medical professionals. You are not my child's parent. You exist to teach. By May 2021, there were over 1.2 million Texas students, 153,000 plus Texas educators who had the freedom to choose to wear a mask, take the vaccine, whatever, and yet AISD is changing that only for our group. Parents are responsible for the health of their children. It should be a decision between the parent, the child, and the doctor. I will choose if my child wears a mask. I will choose if my child gets vaccinated. Public education should not be dependent upon either of those decisions. I do support the governor's elimination of a mask mandate. I think children and parents should make that decision themselves. I'm asking you today to prioritize children and their education over union demands and forced healthcare decisions. Thank you.
Hello, my name is Thomas Allen. I'm an AISD parent calling about agenda item 4.1. I'm calling to remind AISD that the primary duty is to educate our children. You're not medical professionals and you're not my child's parent. You're there to teach them. By May 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. They were not required to wear a mask. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent on either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Please prioritize our children over union demands. My child, my choice. Thank you.
Hi, my name is Laura Fennell, and my son is a third grader in AISD, and we would love nothing more for him to go back to in-person classes. However, he's only 8 years old, and he's too young to be vaccinated, and I have some very serious concerns about the lack of requirement of masks in the schools, any sort of lack of, vaccination tracking. I don't, bottom line, trust other people with the health and safety of my son in this circumstance with the Delta variant and with his vulnerability without being vaccinated. So I think it's really reasonable for you to offer an online-only option for those kids that are too young to be vaccinated just until they're able to be vaccinated and fully immune against COVID. I want nothing more for my son to return to in-person class, but I just can't risk his health and safety at this point. And so I'm going to keep him out of school, period. I just hope there'll be an online option because I'm going to keep him out of school until he's fully vaccinated against COVID. And I want him to be vaccinated.
Hello, my name is Brittany Castle. I am the mother of Ariel Ellis, who will be going to 4th grade in this school year. I recently found out that we have health issues in our home, severe ones. I have a blood clotting issue, which has caused me to have several miscarriages in the past 2 years. Ariel is not eligible to get a vaccine yet. Ariel's grandmother passed away 2 weeks after receiving the vaccine due to a blood clot that traveled to her lungs, and she passed, unfortunately. We've been very scared about getting the vaccine right away. We are wanting to get the vaccine, but I'm waiting for Ariel to be eligible. I think it's most important for her to be vaccinated before returning to school. What I'd like to see and what I hope is that we can offer some type of virtual learning. I will pay you to let me virtually teach my kid with your curriculum, if that helps. Up until they are able to get vaccinated, I do not feel comfortable sending my kid to school until she is vaccinated. I think that we could give it a few more months with virtual learning up until they're able to get vaccinated.
Hi, this is Deborah Trejo. I'm an AISD parent, and I'm calling about the ESSER spending item agenda number 5. I'm asking that you redirect the superintendent and the district to spend substantial funds of the ESSER funds to address the enormous inequities and disparities in special education. Special education students were the most impacted by remote learning and COVID. Many did absolutely nothing for months at a time. They are the most acutely inequitably treated already. You made a commitment in November of 2019 to fully fund inclusion in the district and training for teachers, none of which has happened district-wide for gen ed teachers. Now more students will be in special education. You need to take a significant chunk of this money, at least the amount promised in School Changes 2.0 of $10.5 million, and address it to an inclusion training for the entire district and increasing inclusion of students with special needs and addressing their deficits directly related to COVID and its impacts. Thank you.
Hello, my name is Kathy, and I'm a concerned AISD parent calling about agenda item 4.1. I'm calling today to remind AISD of their primary duty to educate. You're not medical professionals and you're not my child's parents. You exist to teach children. By May 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in Texas public schools. Prioritize children over the union demands. My child, my choice. Thank you.
Hello, my name is Brenda. I have twin boys in Callum ISD high school. I'm calling today to remind AISD of their primary duty is to educate. You're not medical professionals and you're not my child's parents. You exist to teach my children. By May 2021, there were 1.2 million Texas students, 153 Texas educators with freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask a child. We will choose if we vaccinate a child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate and mandate of vaccinations in Texas public schools. Prioritize my kids. Don't separate them. Don't mask them. Let them be kids that get to learn.
This is Summer Shelton. I have 3 kids in AISD, 1 each in elementary, middle, and high school. My children all did attempt to attend school last year to the extent they could with the masking, especially my going to be first grader this year. You know, she would go a lot, but she just could not handle the masking all day long, every day. She would miss usually at least one day a week, and she wasn't sick, really. It just made her sick to her stomach to think about wearing the mask all the time, and it was exhausting. And my older ones would not even go a lot of the time because just with the mask. I think that everyone that I know of different political persuasions who think that it might be okay to mask these kids all day did not send their kids with the mask. They don't know. I think that if you want to ask people's opinions about it, they better have already done it for a long amount of days and know how that affected the kids. It is not okay under any circumstance at all to mandate masks for the year.
This is Patrick Shelton. I have 3 children in AISD. Mandatory masks and vaccinations and treating the healthy or quarantining the healthy should not be mandated or should not be pushed by the district. The district's goal should be to try to get back to normal, just like many other school districts in the state of Texas, and including many private schools here in our community have done quite successfully. We need to start really putting the children first and get a grip on the fear. The biggest risk to the children in the community is for the district to treat others differently based on masks and vaccination status. We know enough about the virus by now. It's not 2020, and we have enough testing capabilities to test people that may be exposed to the virus. Thank you.
Hi, I'm Tanya Tasneem, a middle school science teacher at Keeling, and I'm a proud Education Austin member and the only Teach Plus fellow from AISD this school year. I wanted to thank Trustee Singh and Trustee Lugo for hosting a listening session yesterday and Dr. Ellie Salde for taking time to hear us. Yesterday, you asked us about what keeps us up at night, and as I browsed through the agenda and slide presentation, one thing that concerns me is how we are going to communicate the narrative of, quote, learning loss, unquote, to families and students. I personally will not be setting my students up for success by starting the year off with, hey, we are behind. I'll call it what it is. Those are standardized test scores, and I don't have anything nice to say about that, so I won't say anything at all. I'm curious about the autonomy and support that teachers will have to create meaningful assessments that show the growth and progress of their students where they are at if we choose to modify the district scope and sequence. Thank you, and go Hornets.
Buenos días, mi nombre es John McKenna González. Estoy dando comentarios sobre los fondos ESSER 3 que vienen del Congreso y quiero apoyar que se distribuya más dinero a fondos de educación especial, o sea, cuestiones de discapacidad para los estudiantes en secundaria y en la preparatoria. COVID-19 ha afectado más a los estudiantes que tienen discapacidades y por lo tanto ayudar a esos estudiantes que se van a graduar en este momento no va a crear una responsabilidad permanente, pero nos va a dar la oportunidad de poder intervenir y ayudar a los estudiantes que los necesitan más. Estamos obviamente en crisis de pandemia y todos queremos recuperarnos bien, pero yo creo que este uso de fondos de emergencia para poder recuperarnos todos como institución, como escuela y como estudiantes que han sufrido la cuestión de COVID-19 se me hace muy bien, muy ético y muy responsable fiscalmente poder poner más recursos para los estudiantes con discapacidades en la secundaria y la prepa. Se me hace muy buen uso de recursos de emergencia para ayudar a las gentes más afectadas.
This is an interpretation into English of John McKinnon Gonzalez's message. Good morning. My name is John McKinnon Gonzalez. I am commenting about the ESSER 3 funds from the government, and I would like to support the distribution of the money towards special education funds. That is, toward issues related to disability for middle and high school students. COVID-19 has affected the students with disabilities more, and therefore, helping those students that will graduate at this moment will not create permanent responsibilities, but it will give us the opportunity to be able to intervene and help the students who need it the most. We are really in a pandemic crisis, and we all want to recuperate well, but I believe the use of the emergency funds to be able to recuperate as an institution, as schools, and as students who have suffered the issue of COVID-19 seems to be really good, really ethical, and very fiscally responsible to be able to assign more resources for students with disabilities in middle school and high school. I find it to be a very good use of the emergency resources to help the people most affected.
Hi, my name is Lisa. I'm a concerned parent in AISD, and I'm calling about agenda item 4.1. I am calling to remind you that AISD's primary duty is to educate. You are not medical professionals, and you are not my child's parent. You only exist to teach children. By May of 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school or not. Parents are responsible for the health of their children, not you. We will choose if we mask our child, and we will choose if we vaccinate our child. Public education is not dependent upon either one. We support AISD updated protocols that align with Governor Abbott's elimination of any mask mandate in the Texas public school. Please prioritize children over union demands. My child, my choice. Thank you.
My name is Katie Arb. I'm calling about COVID protocol. I have 2 kids under 12, and I'm not comfortable sending my kids back to school with case rates going up in the county moving back to stage 4, especially since in ASD schools there will be no mask requirements, no real social distancing with 20-plus kids back into classrooms, and no vaccinations. This seems like a recipe for disaster. Will Austin ISD follow Round Rock's lead on a virtual option? What are you doing to reassure parents that their kids aren't going to get sick at school? Because the current plan is basically business as usual. Our kids made too many sacrifices last year to put them in harm's way this year. Also, Greg Abbott can win re-election. Stop telling us Greg Abbott says, the state of Texas says, and tell us what you're going to do to protect our kids, because if things don't change, my kids will be out of ASD in the fall. Thank you.
This is Richard Togley with the Andy Roddick Foundation on behalf of the 36 organizations that are part of our Learn All the Time initiative. I urge the Austin Independent School District Board to keep our students safe and healthy by letting all schools observe CDC and APA guidelines and protocols to avoid and prevent COVID-19 infection. I also urge the school board to invest some of the federal funds under ESSER 3 in out-of-school time learning opportunities, as students need all the support they can get from their schools, their families and communities, especially after-school programs, to continue to be healthy, learning, and thriving in these challenging times. If you need more additional information, I'm free to be contacted at the Andy Roddick Foundation. Thank you so much.
Hello, my name is Heather, and I'm a concerned AISD parent calling about agenda item 4.1. I'm calling today to remind AISD of their primary duty to educate. If you are not medical professionals and you are not my child's parent. You exist to teach children, and that is it. By May 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public schools or not. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. We support AISD updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Prioritize children over the union demands. My child, my choice. Thank you.
Hello, my name is Diana Sanchez. I am the parent of an incoming pre-K student with AISD. I am calling to leave comments regarding COVID safety procedures and virtual learning options. It appears at this time AISD is still deciding on how to offer virtual learning or if it is possible at all. And I would like to offer my support that we allow for more virtual learning options, just as we did last year due to the Delta surge in COVID right now, and giving parents the opportunity to keep our children enrolled and not have to withdraw, because that is what my family will likely do if we don't have a virtual option. As we all know, children under 12 do not have the opportunity yet to be vaccinated, and lots of families like my own do not feel comfortable sending our children into a school building where masks are not required, and having them possibly become ill. So online virtual learning options for the fall at least would be greatly appreciated.
My name is Christy Kurtz, and I'm the parent of a junior at McAllen High School. I'm calling to encourage the board to make accommodations for remote learning in this upcoming school year, regardless of what the state mandates. I'm also asking that masks be required at all schools at AISD and at all functions. Thank you.
Hi, my name is Joy, and I am a concerned AISD parent calling about agenda item 4.1. I'm calling today to remind AISD of their primary duty, which is to educate. You're not our medical professionals, and you are not my child's parent. You exist solely to teach my child. By May 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Prioritize children over the union demands. My child, my choice. Thank you.
Hello, my name is Lisa Flores. I'm a parent. My comment is about agenda item 5.1. I'm very concerned no activities under IDEA until the 22-23 school year was checked. Why? Considering the current state of special education in AISD, it seems like this is a mistake. Specifically, earmarking funds for compensatory services because of COVID learning loss and because of the current situation of reevaluations is a vital remedy. This presentation seems to suggest ESY is only available to students served by life skills and other specific early childhood groups. ESY should not be limited to specific groups and should be granted on a broader and more individualized basis. This will require training. I am not clear how students with disabilities will participate in extended learning opportunities in the absence of a district-wide inclusion model and in the absence of IDEA activities for the coming school year. Please dedicate ESSER 3 funds specifically to students with disabilities who've been disproportionately impacted from COVID and from the evaluation situation. Thank you.
Hi, my name is Christina Schmaltz, and I am a parent of a currently enrolled AISD student. My question is, could you provide information on the plans to continue access to education for students who are quarantined due to exposure to a COVID-positive case? Specifically, will teachers be providing access to their classes virtually for quarantined students? And if not, how will these students be supported academically during the 10 to 14-day quarantine period or periods that they must be subjected to? Thank you so much. Bye-bye.
Thank you for the chance to comment on the district's recently released COVID protocols. My name is Whitney Thurman, and I am an assistant professor of nursing at UT Austin, and I am the mother of a sixth and a first grader in the district. I am concerned that the governor's restrictions on masks have resulted in the district abandoning other evidence-based strategies for preventing the spread of COVID. First, we know that shared eating spaces where people are unable to mask are very risky for the spread of COVID. Why then is the district planning for all students to share meals in the cafeteria, especially those who are too young to be vaccinated? Hand washing prior to eating does nothing to reduce the risk of transmission of an airborne virus in the middle of a busy cafeteria. Mealtime should be outside whenever possible and in the classroom when not. In contrast, there is no evidence indicating that plexiglass prevents COVID transmission. Instead of plexiglass, all classrooms should be provided with box fans to help keep air moving. Finally, the district should communicate that mask wearing is expected, not just encouraged. Messaging should emphasize the expectation that everyone wears a mask in order to protect the entire community. This does not contradict the governor's order, but it does create a shared cultural norm of mask wearing. Thank you for listening and for your continued efforts to help prevent COVID-19 transmission in schools.
Hi, my name is Christy. I'm a concerned AISD parent calling about agenda item 4.1. I would like to say that parents need to be responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. The studies and the research and literature across the world has shown that this is the lowest risk group possible, and they are not super spreaders. There has been one actual COVID death, not died with COVID in the child in the United States, according to CDC's own records. We support AISD's updated COVID, and we align with Governor Abbott's elimination of any mask mandate in a Texas public school. Prioritize children over the union demands. My child, my choice. Thank you.
Hello, my name is Amber. I am a concerned AISD parent. I'm calling about agenda item 4.1. I just wanted to remind AISD of their primary duty to educate. You guys are not medical professionals. You're not my child's parent. I am the one that will make the decisions about whether or not my child will be masked or vaccinated. Let me mind you, I am also a registered nurse with a 4-year bachelor's degree. And this is up to the parents to decide if the kids will be masked or not, and I will not let my child be segregated or separated based on that status either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Please prioritize children over the union demands. My child, my choice. Thank you very much for your time.
Hello, my name is Natasha Rogers. I am a parent of an elementary age student. I'm talking about COVID safety measures. I know AISD cannot enforce masks due to Governor Abbott's executive order, even though the CDC in Austin in stage 4 recommends vaccinated and unvaccinated people to wear masks. Kids under 12 cannot get the vaccine, so they are not protected. PPE such as masks are the last level of protection in the safety and risk hierarchy of controls. Elimination is at the top. It should be the first thing done. Virtual schools work to eliminate the risk, but AISD claims that it's cost prohibitive, even though they were gifted $155 million of ESSER funds. AISD's job is to protect the health and safety of our children. They're failing in this mission by not allowing an option for virtual schooling and stopping other COVID safety precautions. AISD is being irresponsible by not having a virtual option for children that are the most vulnerable right now, especially with the rise of the Delta variant. I'm withdrawing my student because AISD and the trustees are not protecting my child, and they are putting money ahead of life. Thank you.
This is Sharon Bain. I'm the parent of 2 AISD high schoolers. First, I've noticed increasing efforts to encourage universal masking on the return to school, and I really do appreciate it. Keep pushing this and setting the expectation that in AISD, we will all wear masks, regardless of vaccine status. We do this to help protect our youngest learners and to do our part as individuals to protect the health of our school and our extended community. Second, the district can and must do better in letting families know more about what to expect when school begins. How will students who are out on quarantine continue with their studies? What about teachers? What if they have to be out for longer? Parents need specifics around this piece. While I'm well aware that the district is in a tight spot funding-wise, this does not negate the need for information to come in a timely manner so that families can be ready for the year. Without these details, parents are far more likely to decamp for a sure thing away from AISD. We want and need families to stay with us. Thank you.
My name is Andrea Vigil. I am an AISD parent. I was calling in reference to the COVID-19. As far as y'all not offering virtual learning for the children this year, I have 3 kids that attend Sanchez Elementary. We will be welcoming home a premature newborn come August. My concern is the fact that there is no mask mandate. As far as Greg Abbott, I've sent emails to everybody I need to in AISD as well as Greg Abbott. So I'm asking that y'all please consider giving that option to parents for the safety of their kids and the safety of anyone else they may be around that can't fight off illnesses as well as other people can. Would greatly appreciate it. Thank you.
Hi, this is Sundip Parekh. I'm a Maplewood parent, and I'm calling in reference to Agenda Item 4, which is COVID-19 safety. I would like the superintendent and trustees to reconsider kids eating in the cafeteria for breakfast and lunch. If kids under 12 cannot be vaccinated, I strongly feel that having them eat together is unsafe, even with assigned seating. Please reconsider this policy and have students eat in the classroom this year, as it is the safest possible environment for now. Thanks.
Good evening, trustees and Superintendent Elizalde. I'm Louis Malfaro, Associate Executive Director of Austin Voices for Education and Youth. Austin Voices is a longtime partner of the district, helping schools become community schools and establishing family resource centers to connect students and families to resources in the community. This past year has put us all to the test, and we're proud of our work in partnership with the district, supporting families and students during the pandemic. We're pleased to see in the district's ESSER 3 plans an emphasis on engagement with the community and specific goals for improving communication between families and AISD, as well as training staff to work better with parents, creating extended learning opportunities, and cultivating community learning spaces. These are all elements of the community schools model Austin Voices utilizes in our work with campuses. We're eager to support the district's efforts in these areas and are available to work with you to achieve the goals you've articulated. We look forward to building on our existing partnership and finding new ways to work together to create community schools in AISD.
Hello, my name is Rich Kelly. I am the parent of an incoming freshman at Austin High School. I am a product of Austin ISD myself. I live and vote in Geronimo Rodriguez's district, and I teach at Austin High School, where we are happy to welcome our new principal returning to our campus. I wanted to call tonight, though, about reopening schools back in August, in light of the fact that a study out of Israel tells us that the Pfizer vaccine is only 39% effective against the new Delta variant, and that all of our students between the ages of 12 and 17 who have gotten the vaccine have gotten Pfizer, since it is the only one approved for that age group. And the fact that none of our students below the age of 12 have gotten any vaccine, and we do not know what the long-term consequences of catching COVID for children are, I would urge the board to consider trying to create some sort of virtual option, despite the state's unwillingness to fund that option, for all students, but particularly those under the age of 12 who cannot get vaccinated, and also to accept the consequences, the fine of asking students to wear masks.
We should not have to list in 10 minutes of Spanish when we only want to be on there and make sure that my granddaughters and grandsons do not have to have government or anyone else taken care of. And parents are responsible for the health of their children, and we choose to not use masks. We should not be made to do that. We should not also be made to use vaccine for our children. Public school is not dependent upon either. We should be able to choose for our own children, able to take care of the grandchildren and everyone without all this confusion of being forced into this thing. There's no excuse for that. And I'm planning to call Attorney Abbott's office also when you call. Thank you.
Hello, my name is
Nathan Rakonis, and I'm a concerned AISD parent calling about agenda item 4.1. I'm calling today to remind AISD of their primary duty to educate. You are not medical professionals, and you are not my child's parent. You exist to teach children. By May 2021, there were 1.2 million Texas students, 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our children. We will choose if we vaccinate our children. Public education is not dependent upon either. We support AISD's update COVID protocols aligned with Governor Abbott's elimination of any mask mandate in Texas public schools. Prioritize children over the union demand. My child, my choice. Thank you.
Hi, my name is Jessica Colrankin. I'm the parent of a rising kindergartner and second grader in Austin ISD. I'm calling regarding COVID and the safety measures. We are very concerned for our children. I know we are not the only one, considering they're not vaccinated and we don't know exactly when they will be vaccinated. I understand that masks can't be required per the governor's orders, but we ask the Austin ISD and board members to consider allowing schools to have classrooms that are designated masked classrooms where every single child in there has opted into wearing masks. That way it hopefully decreases any positive cases. Also, we definitely would like a virtual option like Round Rock is doing, or even a tuition-based virtual option, sort of like what we do for pre-K. I would also like the reconsideration of eating in the cafeteria as a requirement. I know as a parent, I would definitely volunteer to be a lunchtime monitor within the classroom. Thank you again, and any reconsideration that you could do would be greatly appreciated.
Thank you so much, Austin ISD School Board, Board of Trustees. Thank you for the opportunity to provide public comment. My name is Makona Collier. I'm a public policy fellow for United Way. And we have presented to Austin ISD a robust proposal from our Greater Austin Reading Coalition that focuses on significant one-time funding of ESSER dollars in addressing learning loss and building out an equitable plan to address the need for literacy coaching and high dosage tutoring. This plan is not intended to fund United Way programs, but to support Greater Austin Reading Coalition's strategic goals, because with the powerful investment of the American Rescue Plan Act dollars and the specific focus on learning recovery, we have an incredible opportunity to build something new and sustainable that will continue to serve our youth long after the pandemic. Thank you so much.
Hello, I'm Jenny Davidson, a parent to two boys in the district. Our 12-year-old was COVID vaxxed via AISD clinics in May and June. Thank you. He was virtual all last year due to being immunocompromised. His fifth grade brother isn't old enough to qualify for a vax yet. Our ask is to require masks as we begin school. They worked last year. Though vaxxed, our older son's medical condition puts them at greater risk and lower immunity. He'll be masked, but not everyone at his middle school is old enough to get vaxxed, and some families have chosen not to. We'd not even consider sending our elementary-age kid to an enclosed classroom without a mask requirement while he can't get vaxxed. We'd have to pursue homeschooling or online options elsewhere until he's fully vaxxed, at which point we'd plan to re-enroll in AISD. But pulling him means loss of funding for our district via less kids enrolled, possible job loss for teachers if enough families choose to do this, and a problem with overcrowded classrooms when students potentially try to re-enroll in a couple of months. Please do everything you can to ensure our community's safety. Maskless, unvaxxed, 100% in-person school during a pandemic that is going in the wrong direction right now does not feel safe to us. Thank you.
My name is Jen Margulies. I'm the parent of an AISD student. Thank you for this time to comment. My student is supposed to be entering middle school in sixth grade this year, but has health issues that make in-person school at stage 4 unacceptably high risk. We're encouraged to see AISD going beyond the dismally low floor set by the governor and TEA and looking for ways to honor your responsibility to provide a safe education for all students in our district while COVID is rising in our community. We strongly urge you to use whatever creative measures are necessary to both provide a quality virtual option for unvaccinated students with medical need and to put needed safety measures in place for students who will be attending in person, including screening, quarantine, doing whatever it takes to create a culture of consistent masking and giving unvaccinated children alternatives to eating in cafeterias. This significant but temporary challenge facing students under 12 unable to be vaccinated for the first semester has the potential to create critical long-term enrollment and retention issues that AISD can ill afford. Parents need to be able to trust our schools. Thank you.
Hello, my name is Tracy, and I'm a concerned grandparent, and I'm calling about agenda item 4.1. I am calling today to remind AISD of their primary duty to educate. You are not medical professionals, and you are not my grandchild's parent. You exist to teach children. By May of 2021, there were 1.2 million Texas students and 153,000 Texas educators with the freedom to choose to wear a mask inside their public school. Parents are responsible for the health of their children. We will choose if we mask our child. We will choose if we vaccinate our child. Public education is not dependent upon either. We support AISD's updated COVID protocols aligned with Governor Abbott's elimination of any mask mandate in a Texas public school. Prioritize children over the union demands. My grandchild, my choice. Thank you.
Hi, my name is Megan Hiller. I am the mother of 3 AISD students. They are all elementary age, incoming third graders, twins, and fifth grader. They are all immunocompromised. We have spent the last 16 months inside. We very successfully did AISD virtual learning last year, despite the fact that my fifth grader is a special ed student. We were very much hoping that AISD would use the ESSR funds to continue virtual learning into the fall of 2021, particularly with the COVID spike in Austin now that we are in stage 4. I am calling to plea again that we please offer this option this fall. If not, we are unfortunately going to have to unenroll from AISD, which is not what we want to do. Thank you very much for your time.
I'm Zenobia Joseph. My comments are specifically related to item 5.1, Austin ISD Elementary and Secondary School Emergency Relief Proposal. I would ask you to amend Part 1, Equitable Access and Participation Barriers. Public transportation is a barrier in Northeast Austin, specifically in Craigwood and Colony Park, where the route is 60 minutes, which is 10 times longer than Southwest and Central Austin Whites and Dove Springs Hispanics. I would also ask you to recognize that it's a half-mile walk from Pecan Springs and 1 mile walk from Blanton Elementary to 51st Street. There's no service on the weekends, and so if you need more information about the bus routes, Local Government Code Chapter 252 allows you to do a no-bid contract. I'll gladly give you more details. I would lastly ask you to create a portal so that those of us with a proven track record can actually serve the students that are of color and specifically those impacted by COVID-19 that may be low income and need social, emotional, academic instruction as well as professional development for the teachers. And lastly, I'll just call to your attention the need to focus on Cook Elementary, where there will be a homeless encampment.
Trustees, this concludes our public comment period. Are there any questions or clarifications for the administration regarding any of the public comments? Trustee Boswell and then Trustee Singh.
Yes, I have one clarification. A great number of the callers mentioned pressure from unions. I think we all know that Education Austin can be really effective when it chooses to have an outreach campaign or an email campaign. I personally have not seen any emails. I'd love to clarify whether that is a factor that we are seeing, or if this is coming from the community, from public health officials. Thank you.
From the superintendent's viewpoint in our
communications and engagement with Education Austin and ATPE. Neither one of those has lobbied us in any specific way. They have expressed concerns like many of our teachers have that, and our staff have, period, in general, custodians, bus drivers, TAs, or teacher assistants have expressed concern regarding masking. But I would need to say this whole conversation is beyond just that an employee organization is putting pressure on me in any way would not be an accurate reflection of the quandary that we're in.
Thank you for clarifying that. I appreciate it.
Thank you, Trustee Boswell. Trustee Singh and then Trustee Anderson.
Thank you. A couple questions. One is, does the district check to see if people claiming to be Austin ISD parents actually are Austin ISD parents? Referring to the callers.
Regarding the public comment, typically there's a little more information given than I heard today. I have asked them to just simply review the information that was given during public comment.
Okay, thank you. I also wanted to follow up. There was a caller from the Andy Roddick Foundation and another caller, I can't remember which organization, but it was related to the Greater Austin Literacy Coalition. I might be getting the name of that group wrong, but I do recall getting an email from them, and they were talking about Literacy First and a couple of other literacy programs in Austin. I was just curious to know if the district has been talking to them or has followed up with them in any way.
We have, and I need to be very careful due to procurement laws and not have any vendors actually lobbying any of you currently through a public comment venue. So what I would like to say is that we are proposing an expansion either with or without the ESSER dollars. We do and are committed to an expansion of after school, before school type activities. And we will continue to work on that. And I believe we have some relationships already. We definitely have one with the Andy Roddick. I am not aware of the others, so I would like to reserve that until further investigation.
Appreciate that. Another question, and several people mentioned cafeterias and quarantining of students. You don't have to address those right now, but I was just curious to know if there would be details on safe lunchtime, possible outdoor solutions, et cetera, in a future back to school plan.
We will be discussing fleshing that out in more detail. Outdoor spaces for both learning and other activities will be incorporated in the overall plan.
Okay. And the last thing I want to mention is one of the callers referred to the school changes plan that was approved by the board in November of 2019. And so I just wanted to request for a future board meeting that we revisit that, because that is something that the board voted on. And I'm starting to hear from constituents, and I've wondered myself, are we still beholden to that? What's the status? So it would just be helpful for us to perhaps revisit that in the fall.
And without getting into discussion, as it's not an item up for discussion, I do want to confirm that we are, in our view, certainly in my view, we are committed to that. And our team is preparing activities, responses, and timelines for each of those areas.
Thank you.
Thank you, Trustee Singh. Trustee Anderson.
Trustee Singh, that was United Way. And Dr. Elizalde, the last caller mentioned I guess a homeless camp either near Cook Elementary. And so at some point, can we, do you have any information, or, because I have some concerns about that as well. A future discussion, I'll say that, yes, a future discussion.
We will provide updated information, and both written in our board update this week, as well as a future meeting.
Okay, thank you.
Trustees, any other comments? Trustee Zapata. Oh, you're on mute. There you go.
Okay, thank you. So there was several calls about the special ed funds. I know that there was a big effort done to catch up with SPED. So could we schedule an update report presentation so that we can know what the status is and how everything was resolved?
Yes, ma'am, that is planned for August. And we will also provide an update in written format this Friday's board update as well.
Thank you.
Trustees, any other questions or clarifications? If there are none, I'm going to move to our first agenda item, COVID-19 safety. And Dr. Elizalde, will you take us through our first item dealing with COVID-19 data, safety protocols, and protection measures?
Thank you so much, President Rodriguez, members of the board, and our public who is listening in. Thank you for the opportunity to provide you some additional information. As we all know, I think the word pivot is an understatement, and our team has decided we are now on a swivel, not a pivot, because it is continual. I am very fortunate to be on a team with Austin Independent School District staff members who are always looking to find a way to say yes. And so with that, we know there may still be some additional changes, and we've also have some additional guests, and Dr. Reach will let me know when we think that's also appropriate. But at this point, I would like to turn it over to Dr. Anthony Mays so that he can take us through our COVID-19 data, safety protocols, and protection measures, and where we are in that process.
Good evening, trustees, President Rodriguez, and Superintendent Elizalde. Can you all hear me? Can you give me a thumbs up if you can hear me?
You're a little low.
If you could turn up your volume just a little bit, Dr. Mays.
Is that better? Hold on one second. Let me do this. Okay, is that better? Can you all hear me?
Yes.
Okay. Dr. Reach, will you be sharing the presentation, or will I be allowed to share my screen? All right. Thank you. So tonight we did want to be able to share with you all, again, just a brief overview of where we are currently. And so this is still a work in progress. But we do want to share with you all some celebrations. And so since mid-April, we've been able to host 47 vaccination clinics serving over 7,000 people held at our campuses. That does not include campuses or clinics hosted by other agencies. Those are the ones that we've hosted. We've also been able to administer over 10,000 rapid tests for this school year, this past school year. That placed us top 5 in the state. And so we've done a really good job of standing it up. So kudos to our health team and Ms. Copeland. We were also able to close out the year with a degree of normalcy with 28 total indoor, outdoor proms and graduation ceremonies. And so we were able to see the joy and delight that our families experienced from that. And 100% of our staff have been offered the opportunity for a vaccine. And so we're committed to, again, growing and producing more opportunities for our And so here, 65%, you see our kiddos jumping up and down and having a good time. By the end of the year, this is what school looked like for us at the elementary level. We were able to see a good bulk of our students moving into the classroom and doing so safely. And so 65% was the average daily face-to-face attendance at the elementary level. Again, we know that learning in person is the best possible way to be able to meet the needs of our students. And so we did see that rise throughout the year. Again, we started out the year around 37%, but by the end of the year, we did see some pockets where we had upwards to 88% of the students attending face-to-face on campus. We did have some struggles at the middle school and high school levels to meet those attendance rates that we pushed to have at every level. You can go to the next slide, Dr. Reach. So we have 3 things that we're focused on as we open up this school year. And so you can see health and safety, of course, is a priority for our team. We think we did a pretty good job last year of keeping everybody safe, but of course, there's always room for improvement. And so we'll continue to have health and safety guidance and protocols implemented at our campuses. Ms. Copeland will expand on that within this presentation. And campus and safety protocols again, will continue to be in place even on our buses. Communication, we are currently engaging, if you go back one more slide, Dr. Reese, thank you. Communication, we're engaging our community right now as we speak to try to garner more information as to the best ways to communicate some of these changes, as well as to hear from our principals and our teachers some of the concerns. And so this week we are actively engaged in that process. You can go to the next slide, Dr. Reese. And so you see here, this is, again, a visual of what we have. Our safe and ready schools are where we want the bulk of our students. And so those are students that are actively participating in face-to-face learning opportunities. And so it's our hope that a great majority of our students will take advantage of that. But we've also heard some of the needs that have been expressed. And so we also have our K-6 virtual option that we are working on standing up. And that will be for a limited number of students that may not be eligible for COVID vaccine. And so we recognize that those students may not have the opportunity just because of their age. And so we'll offer that virtual option. We also have AISD homebound services, and this is reserved for eligible students with underlying conditions. And so, again, we have these options and these opportunities, but again, K-6, there will be a limited virtual option. And we'll continue to gather feedback and communication from our community this week to be able to become more informed about how we prioritize who gets that opportunity. You can go ahead and go to the next slide, Dr. Reach. And so I'll go ahead and pass it over to Ms. Copeland to expand a little bit on some of our safety protocols and measures that we have in place.
Thank you, Dr. Mays, and good evening, Board of Trustees. I apologize for my voice. I'm getting over some allergies right now. I am Alexandra Copeland, Director of Health Services for AISD. I really want to take some time on this slide to talk about last school year and then talk a little bit about what we're doing for this upcoming school year. We entered new territory last year, and while we faced and rose above many challenges, we also have many positives to highlight. Dr. Mays shared just a few of those positives related to health and safety that we saw. Of our in-person learners last school year, only 2% of our in-person learners tested positive in the 2021 school year, which was lower than many of our surrounding school districts. We have had no student deaths related to COVID-19. We have had no outbreaks or evidence of transmission tied to the classroom or in-person learning. With our number of outbreaks being much less compared to many school districts across the state, the handful of outbreaks that we have had were all tied to extracurriculars, with initial transmission stemming from activities and gatherings outside of the school setting. As Dr. Mays mentioned earlier, we were among one of the top in the state for a rapid testing program, administering over 10,000 rapid tests since November of last year in partnership with Ascension Seton, who provides our campus health room staff. Our positivity rate from our rapid testing program in our health rooms and through our mass testing events has consistently stayed lower than the Austin-Travis County positivity rate. In addition to the COVID-19 testing, we have partnered with multiple local agencies to provide COVID-19 vaccination opportunities on our campuses. Since April of this year, when the vaccine became available to our students, we started our pop-up COVID-19 clinic initiative on our campuses, prioritizing the areas that have been COVID-19 hotspots throughout the pandemic. We have hosted close to 50 vaccine clinics and have administered over 7,200 vaccines to our students, staff, and families on our AISD campuses through our pop-up clinics, with almost 50% of those being for our students. This is not including our efforts outside of our pop-up clinics that started in January of this year, where we have partnered and advertised clinics to provide over 6,300 vaccines to staff and students, totaling close to 14,000 vaccines administered to our staff, students, and families that we have helped to coordinate since January. One of our hardest hit areas during this pandemic has been Dove Springs. We have hosted clinics at 4 campuses in Dove Springs, vaccinating 636 individuals at those clinics. We will be hosting clinics at 2 more campuses in Dove Springs within the next week. Our rapid testing and vaccine efforts have been recognized locally at the state level and nationally, and have been used as models for other school districts across the country. We are continuing our health and safety protocols from last year, as they've been proven to keep our students and staff safe. Throughout this pandemic, we have continued to update our health and safety protocols to be aligned with guidance from the Centers for Disease Control and Prevention, the American Academy of Pediatrics, and Austin Public Health, also following governmental mandates from the Texas Education Agency and the Governor's Office. In the 21-22 upcoming school year, we will be strongly encouraging all individuals to wear masks to protect themselves and others, as we know that it adds an additional layer of protection on top of getting vaccinated, which is the most important safety measure. We are also encouraging frequent hand washing and physical distancing when feasible. We will continue to provide rapid testing in our campus health rooms and vaccine opportunities across our campuses. We will have seating charts in classrooms, in cafeterias, on buses, and in other spaces, which will lessen contact and assist continuing to follow CDC guidelines for our isolation and quarantine procedures. Sick individuals that are showing COVID-19 symptoms or have tested positive for COVID-19 will be required to stay home and isolate for 10 days. Individuals that are unvaccinated that have close contact with someone that tests positive will be required to quarantine for the updated 10-day minimum. Close contact meaning that they are within 6 feet for over 15 minutes or more cumulative in the 24-hour period to the positive person when they are contagious. Vaccinated individuals will not be required to quarantine per CDC guidelines. Students that will need to isolate or quarantine will have the opportunity to access their course content independently through Blend. What many don't know and what is unique to AISD is that we have an internal public health team that individually responds to each COVID case, conducts contact tracing, and consults with Austin Public Health when needed, which will continue into the new school year. We are continuing our rigorous cleaning and disinfecting protocols across our campuses, in our facilities, in cafeterias, and in our buses. Our classrooms will be equipped with plexiglass. Air purifiers will be provided in every classroom, and HEPA filters will be in every AISD building. In addition to our health and safety protocols, we will maintain our transparency with our families and community by updating our COVID-19 dashboard daily. Our data from last year, our testing and vaccine efforts, and the continued implementation of our health and safety protocols highlights how safe our schools are for our students, and that we are committed to providing a healthy and safe learning environment for all. We will continue to monitor our protocols and adjust based on new guidance that is released. Thank you, and I will now be turning it over to our Chief Academic Officer, Elizabeth Casas.
Good evening, everyone. As is our practice, we consult the data we have as a starting point to understand our context. In August, we will go deeper into end of the year STAR data. However, we wanted to share at a high level some student performance data at the MEETS grade level. You will hear later tonight more on the use of ESSER funds and how they will be used to address the impact of COVID. And the data is particularly important tonight given the new requirements of House Bill 4545 that requires accelerated learning and targeted student tutoring for students as a result of their performance. So here you see spring of 2021 data at the elementary level. The colorful bars are the performance of spring of our current data, and the gray are the 2019 data. You'll remember that last year the STAR and EOCs were not administered. As you can see, performance was down in every subject area, with the biggest drop in math down 21 percentage points. Now, it's something to keep in mind that this is 75% of the students participating in comparison to 95% of the students participating in 2019. One thing that we want to note is that we had 11,497 students did not pass a test. And again, students taking multiple tests count on multiple times, but 11,497 students did not pass, and an additional 9,000 plus that did not take. That's important because that's 21,000 students that will require accelerated instruction and tutoring in one or more subjects. Next slide. At the middle school, we see similar declines in performance at the MEETS grade level standard, ranging from 13 percentage points in reading to 22% in science. And again, the participation rate is very important to be noted here, that 37% of our students participated compared to 95%. So given that data, we have 8,000 students that did not pass a test or tests that were not passed, and 27,000 that did not participate in the testing, giving us 35,000 students that need additional supports at the middle school level. Next slide. At the high school level, the results of EOC assessments were much closer to 2019 results, except for algebra. Now, the algebra results are including the math at the middle school level, and again, the 37% participation rate could have impacted that. However, you look at English 2, it showed a 5% gain in the percentage of students who achieved at the MEETS grade level. And again, here we have 75% of the students participating in EOCs compared to 95%. And so the number of students that will need additional supports is 12,000, giving us a total of about 68 possible thousand tests that will need an additional accelerated instruction and tutoring. And that's important in how we then allocated the ESSER dollars to support our students. Next slide. And so here we just wanted to share some of the current challenges given the safety precautions and the uncertainties that the Delta variant has created. And again, children that are not eligible for the vaccine, and then the quarantine protocols that are currently being fully developed in terms of what they will look like this coming year. And then the legal restraints of schools being prohibited in the form of mandating masks. And with that, I turn it over to George.
Good evening. So please recall last month, the Board of Trustees adopted a $43 million deficit in the general fund, which did not include any of the ESSER funds that we will discuss later this evening. The fiscal year 2022 budget was built on assumptions and estimations to the best of our knowledge at that time, like preliminary certified property values, student enrollment estimations, and then the budget and the district is staffed based on these estimations. So our financial pressures include a deficit budget and a diminishing fund balance that has been used for financial stability for programs and staff and unexpected COVID expenditures for the past year and a half. Next slide, please. So since we will not receive funding for students learning virtually, providing a virtual option will result in a loss of district revenue. So at this time, it's hard to estimate the total loss, which is dependent upon the number of students and then the length of time that virtual is provided. but this slide shows a few different high-level scenarios with a conservative assumption of $9,000 per student loss in revenue for an entire year. So as you can see, depending on the number of virtual students, the loss of funding, depending on, if it's a semester or an entire year, could be anywhere from $4.5 million to $45 million. Next slide, please. And so the current ESSER plan, ESSER 3 plan, will be discussed in further detail in the next presentation this evening. But I'll briefly note that the current plan is spread over 3 years and includes new student-centered investments, and supplanting the general fund's $43 million adopted deficit. And this is to preserve staff and programs, and then any kind of using federal ESSER funds to replace a loss in district revenue or offer a virtual option would mean decreasing either funding for some of these investments or increasing the adopted deficit. Next slide, please.
And so thank you, Mr. Gagonis. We appreciate that insight. And so, again, we've been actively listening to the feedback, and so we are working to stand up a limited capacity K-6 virtual option. And so we are asking for parents to maintain a 9-week commitment that are selected this week, including this evening. We are actively working with our stakeholder groups to gather feedback on who will get the priority for these opportunities. And so it's important that we co-create this with that community input. And so we're looking to make sure that the essential student services are provided within that platform. And so students will be leveraging blend and direct virtual instruction that is teacher-led. And so those students will have a teacher. That teacher will not be necessarily attached to a campus, but will be meeting the needs of the virtual students that are selected for that opportunity. And they'll enroll based on criteria. Again, it'll be co-created from the work that we're doing this week with our community. Students will be able to remain enrolled in their home campus. You can go ahead and go forward, Dr. Reeds. Homebound services, again, like we said, that is another level of support for students that have medical or health conditions that, again, qualify them for that program. We will be communicating throughout all of our elementary school campuses this opportunity to all of our families that may need to take advantage of the homebound services. And so in addition to the K-6 limited model, we also have homebound services where we are ready to meet the needs of our families that may qualify for this program and may need to stay at home to have their instructional needs met. Next slide, please. And so what you have in front of you are our dates, our timeline, again, for this work that we're engaged in. And so this week, we are working with principals and teachers as well as some of our stakeholder groups to gather more feedback around the virtual school that we're working to stand up. All of that feedback is helpful, especially as we look at the limited opportunities and the students that may qualify for that. And so you all can definitely review that whenever you have some time. Next slide, please. We definitely want to make sure that we lead by example. We've been wearing masks again here in central office, and we plan to try to make sure that we model that for everybody within the district. And so we want to encourage everybody to maintain that extra layer of protection that Ms. Copeland shared. And then we just ask that everybody, again, talk to your colleagues, families, and neighbors, especially those that live in Texas, in support of dollars to support the virtual option that we are working to stand up, that we know there's limited funding given this situation. And that is actually the end of what we have today. Thank you.
Thank you. Board of Trustees, I'd like to also welcome some special guests that we have for our meeting today. We have Dr. Lauren Myers, a professor of biology at the University of Texas and the director of the UT COVID-19 Modeling Consortium. We also have her colleague, Dr. Spencer Fox, who is a researcher at UT. And then, so Dr. Myers and Dr. Fox are going to provide us a short presentation, and then we will have Dr. Mina Iyer, who is the Chief Medical Officer of Dell Children's Medical Center, join us, and she's going to share some that she's seeing with COVID and masking. So Dr. Myers, I will pull up your presentation for you.
Thank you, Dr. Reach, and I'm glad to be here with all of the board members, leadership of AISD, and general public. I'm going to go ahead and share from my screen if that's okay.
Not a problem. 1 second.
Okay.
Go ahead.
Okay, thank you. Okay, so I've prepared just a few slides in collaboration with my colleague, Dr. Spencer Fox, to provide a situation update, both in terms of what's happening in Austin and sort of the state of our understanding of the COVID virus, the pandemic, and the recently emerged Delta variant. So let's start with the Delta variant. This graph is showing our estimate for how quickly and completely the Delta variant has emerged and spread throughout Texas. This is a graph. It's showing time from May through the present. And on the y-axis, it shows the proportion of cases caused by the Delta variant. And so what you can see is in the May and June timeframe, Delta quickly rose to become the cause of most infections, over 80% of infections that are occurring now in Texas. So there are some things we know about Delta, for example, how quickly it's emerged in Texas and other parts of the US and the world, but there are a lot of things that are still quite uncertain about Delta. So this is where we sort of stand with respect to our understanding. We believe that as far as the pace of transmission, we believe that Delta spreads more quickly than other variants that have been recently circulating. There's evidence from numerous different data sets from around the world. It is possible that Delta has a shorter incubation period. This is not conclusive, but there's some evidence from one study that when somebody becomes infected with Delta, they more quickly develop a high viral load. If they're going to develop symptoms more quickly, are tested positive more quickly after infection. If this is true, that means the pace of transmission is faster. Somebody can infect others more quickly after being infected. And it may, as I just mentioned, this one study suggests that Delta may produce higher viral loads in people who are infected than other variants. And this can correlate with how infectious a person is when they're infected, how likely it is they are to spread the virus to those they come in contact with. As far as the severity of infection, we really don't know at this point whether Delta is more likely to lead to severe symptoms or hospitalizations. There is one study out of Scotland that reported that Delta may be more likely to cause hospitalizations, but there are some concerns over how that data were analyzed, and there have not been any other studies published yet that really confirm that estimate. So that is a key uncertainty. And then as far as the efficacy of interventions, vaccines may have lower efficacy against Delta, but so far it seems that they are still highly protective against severe infection by Delta. So it may be that people are more likely to become infected, but not more likely to become hospitalized if they are infected with Delta and vaccinated. And finally, face masking, physical distancing, ventilating indoor spaces, proactive testing, where we're regularly testing people even when they're asymptomatic to try to screen for silent infections. These seem to continue to be effective mitigation strategies to slow the spread of Delta, to protect people from infection. And on the slides that we shared with the board, we have a set of references for each of those topics. So as many of you are probably aware, this is the situation in Austin. So this is a screenshot of Austin's key indicators for staging dashboard. This is one of the key pieces of data that is used by Austin when they make decisions as to what sorts of policies to put in place, when to change between different alert stages, when to provide guidelines regarding mask use, et cetera. So what you see on this dashboard, this middle graph, you see it's called the rolling 7-day average of COVID hospital admissions. So it's tracking how many people are newly admitted into hospitals in the Austin area for COVID. And as that number moves into the different colored regions, Austin changes stages. So red corresponds to our most restrictive stage 5, orange corresponds to stage 4, yellow to stage 3, blue to stage 2, and green to stage 1. And those two gigantic swells or peaks, those correspond to the gigantic surge we had in COVID back in summer of 2020, and then the second major wave that we had in the winter of 2020, 2021. And what you can see at the far right end of this graph is the recent resurgence of COVID in our community that is straining our healthcare systems and has led us, the city, to recently declare stage 3 and then stage 4. This is a screenshot of a projection for ICUs from our own dashboard at the UT Modeling Consortium. So we have a number of different dashboards. One of them, we regularly provide 3 or 4 week out projections for hospitalizations and ICU cases in the Austin area. In addition, that dashboard also estimates the reproduction number, the transmission rate through time. And what you can see in this recent projection from our dashboard, and there's a link at the bottom if you want to see other projections or updates going forward, is that there's a lot of uncertainty about where we're headed. So that turquoise line shows what we call our median projection. So that's sort of the most likely thing, but each one of those different spaghetti lines, those light gray lines off the right side of the graph, is an equally plausible projection for where we may be headed. And these projections don't take into account the possibility that people will radically change their behavior, be more cautious, and in that way slow transmission. And if we see sharp behavioral changes, then we would expect to see more optimistic projections going forward. This is where we stand with respect to vaccination coverage in Travis County. This is broken down by age group. So on the far right, you see our overall vaccine coverage at this point in time. So we're at 54% of people are fully vaccinated in Travis County, 62% have had at least 1 dose. And then the other bars correspond to our different age groups, has been discussed quite a bit tonight. Those under 12 do not yet have access to vaccines, and so we have no coverage there. And then coverage increases, generally increases with age group. Our 12 to 15-year-olds were at about 40% fully vaccinated, 53% with 1 vaccine. Our 16 to 49-year-olds, 62%, 72%, and so on. We also are taking a close look at geographic distributions in both risk and vaccination coverage. So this is a screenshot from another one of the dashboards that we maintain at the UT COVID-19 Modeling Consortium. This is the Austin Risk Map dashboard. And what you see in these 4 maps is Austin broken down into its 45 or so zip codes. I'll first draw your attention to the purple and brown map on the lower left. So those colors indicate what's called the Social Vulnerability Index. This is a metric that is provided and calculated by the CDC as an indication of how vulnerable a community is to different kinds of stressors, including pandemics. So the purple zip codes are more vulnerable, less likely to rebound or be resilient to these kinds of stresses, and the brown zip codes are less vulnerable, and you can see a very strong east-west pattern. The bottom right map shows current vaccine coverage for the proportion of each zip code that has received at least 1 dose of vaccine. And you can see there is a strong correlation between the Social Vulnerability Index and vaccine uptake as of now. And then the top 2 graphs indicate the burden of COVID throughout the pandemic. The upper left graph is the rate of hospital admissions for COVID over the last month. And so the brighter pink zip codes are ones that have had more people go to the hospital for COVID over the last month. And then the upper right map is the cumulative COVID deaths that have happened by zip code in hospitals since the beginning of the pandemic. So the darker brown zip codes are the ones that have sustained the greatest burden of death, of mortality from the pandemic. This is another screenshot from that same Austin Risk Mass dashboard. This is showing vaccine coverage, vaccine uptake through time. And we've divided Austin into 4 different regions according to the Social Vulnerability Index. So the darkest blue is the most vulnerable 25% of our population, and the lightest blue is the least vulnerable 25% of the population. And when you compare the dark blue curve to the lightest, almost white curve, you can see that our most vulnerable quartile of our population lags our least vulnerable quartile by quite a bit, both in terms of time of uptake and also overall uptake to date. So looking ahead, based on what we understand about the situation in Austin and the situation in general with the Delta variant, well, let me start by just saying, I believe from what I've heard tonight and from just being in this community for a long time, that in general, we share a couple common goals. I think most of us would agree that we want to be able to open schools as completely and as safely as possible. I also think that we in general want to mitigate the risks of COVID for students, staff, families, and the surrounding community. But we still face a lot of uncertainty regarding the situation with COVID in Austin. We know it's surging right now. We can see that very clearly in our hospitals. And when you look at that key indicators dashboard, we know that there are some real, very strong geographic disparities. In some neighborhoods, less than half the community has been vaccinated. What we've seen over the summer is, particularly in summer camps, is that these outbreaks indicate that the virus can spread quite easily among children, especially when they do not wear face masks. And the risks that COVID will be introduced into Austin AISD schools at the start of the school year will depend on the prevalence of the virus in Austin, which in turn depends on our behavior, the behavior across Austin's community between now and the start of school, and vaccine uptake when school begins. So here are some sensible precautions that AISD is already implementing, but that should be considered at the start and throughout the school year, depending on the COVID situation. Face mask is a really effective measure for preventing transmission, particularly important when prevalence is high in a community. Cohorting or podding of classes, so limiting the number of different people individuals interact with on a daily basis to prevent the possible exposure or having to shut down large parts of a school community when there are introductions. Proactive testing. So this means not only testing people once they're symptomatic or once you believe they've been exposed, but this is, for example, testing every student and staff member in a school on a weekly basis, even if they have no symptoms, as a way of picking up silent infections before they have an opportunity to spread the virus to others. This strategy has been applied successfully in schools and universities throughout the country as a way of gatekeeping the school and keeping it safer. And this is a strategy that can also be applied adaptively in schools or school districts or during times of the year where the risks are particularly high. And then contact tracing, isolation, and quarantine are very effective strategies for controlling outbreaks before they get too far out of hand. So what can we do as a community to achieve our common goals? Vaccines are our best defense as individuals and as a community in the short run and the long run. They offer strong protection against severe disease. And so we should all do what we can to help Austin close gaps in vaccine coverage as quickly as possible. We should take steps to prevent transmission and encourage others to do the same. This does include wearing face masks when out in public, indoors, or in crowds, even if you are vaccinated, and particularly when overall prevalence in a community is high. We should encourage a culture of caution among school children and their families leading up to the start of the school year and when school is in session. And finally, the more we do now to stop the spread of COVID and vaccinate our community, the safer and easier the school year will be. Thank you for your attention.
Thank you so much, Dr. Myers. In just a second, we'll turn it back over to the trustees, but we also want to welcome Dr. Mina Iyer, our Chief Medical Officer of Dell Children's, to speak with us also. Dr. Iyer.
Hi, thanks for having me here today. I'm Mina Iyer. I'm the Chief Medical Officer at Dell Children's Medical Center. And I just wanted to talk a little about the COVID cases we are seeing. So with the spike with the pandemic last year, we did see pediatric COVID patients who were admitted Dell Children's. We did not have any pediatric death from COVID, and then there was a significant decline in our COVID-19 cases. But I would say there's been another spike in our COVID-19 cases over the last several weeks. And the fewer children they've been infected, they can get really sick, and they can also spread this infection to others. So the pediatric and family physician leaders across Ascension, we continue to support the CDC guidance that we strongly encourage everyone to get the COVID-19 vaccine, as it is safe and effective and should be given to all who are eligible. Out of the vaccines that's eligible for pediatric patients, that is Pfizer. It's approved for teenagers who are 12 and above. So 12 to 17 years of age can get the COVID vaccine. The COVID-19 vaccines, they're free. And some of the short-term side effects that a child can experience is some headache, tiredness, muscle ache, and pain at the site of the shot, which is very short duration. And these are some natural reactions and normal reactions to the vaccine. I have myself received the vaccine and have had no adverse effects. And I strongly have encouraged both my family members and my kids to get the vaccine. So to curtail this virus infection that we see in our pediatric patients, we strongly advise everyone to get the vaccine if they're eligible and to continue masking, because even if you're vaccinated, you can get the infection, but it's on a milder side, and social distancing and hand washing. Thank you.
Thank you so much. I just want to let our trustees and our public know that both the district's presentation and Dr. Meyer's presentation is available on board docs under this agenda item, so you can find that there. And I'll turn it back over to Dr. Elizalde.
So trustees, I'm sure that you all have questions for us. We wanted to make sure we could provide as much information up front to see if we could address some of those in advance. But we do have, as Dr. Reach mentioned, Dr. Iyer, we have Dr. Myers, and I think we also have Spencer Fox, who's also here with us also. So with that, and of course our entire team. So with that, President Rodriguez, we'll turn it back over to you, and our team is, I think, collectively ready to take as many questions as we can.
Thank you, Dr. Elizalde. Trustees, I see Trustee Anderson has a question.
Ooh, thank you for the presentation. Boatloads of questions, boatloads, but I'll try to keep it to keep it to a minimum. So on the COVID-19 health and safety protocols under quarantine, can you touch on why, okay, it says vaccinated individuals will not need to be quarantined if they come in close contact with someone who tests positive. Can you talk about why that is?
You're referring to unvaccinated individuals that are in close contact with a positive COVID case?
Yes, I'm talking about that on right there. Okay. All of that.
And I am not the medical official, but we've been trained by them with regard to following those CDC guidelines. And I believe Alexandra may be able, I certainly have a response, but I want to make sure we let our experts handle those. Alexandra?
Yes, Dr. Elizalde, that's correct. So we are following CDC and our local health authority guidelines. So that COVID vaccine kind of adds, right, that extra layer of protection. So if somebody is in close contact with a positive, they are instructed to monitor for symptoms. If they start having any symptoms at all, then they need to isolate at home, and they have to follow the same guidelines that even an unvaccinated individual would need to follow if they were showing symptoms as well.
Thank you. So my next question is, Dr. Elizalde, can you talk about, so Ms. Copeland touched on those students who have to quarantine logging into Blend. How will you ensure that Blend is running effectively? There are no issues, which issues happen, but how will you ensure that students are staying on top of their classwork while they're in quarantine, should it have to be an extended period of them being quarantined? How will you handle that?
Ms. Casas and Dr. Mays have been working on that process, so I'll let them, Dr. Mays, if you want to take that first along with Ms. Casas, if there's anything to add with regard, you all got that question, yes?
Yes, ma'am, we did. And so students that do need to quarantine, will have support assigned to them. Blend, in terms of the technical components of Blend, I know Ms. Costas can expand on that, but I know that that's going to be a platform that we rely on to help those students during that time of quarantine.
So similar to when students are homesick and teachers provide them additional work to maintain their grades, the students will be able to access their courses through the Blend. What we haven't fleshed all the details out is how could we use some other district level support that can connect with the students throughout those 10 days so that we don't have our teachers doing the concurrent teaching virtual and in person. But ideally, we would want the students to keep up with their work at home, and we would provide some district support to them so that they can maintain their grades. But it would not be similar to the virtual where they're logged in all day. It would be a little bit different, similar to if they would receive support when they're homesick.
Right, they would not be zooming in a room to steal a phrase. They would be able to rely on that for assignments, but we would not have concurrent teaching taking place because we do want to make sure that we eliminate that stress as our teachers have worked hard at, preparing to come back and meet the needs of our students. And so we definitely don't plan on having a Zoom in a room or a teacher would have to stand up and provide those two options.
My little concern with that is, though you may not have a teacher there, so the expectation is for a student to log in to do their classwork. What if I am a student who receives supports and really don't have an understanding of, say this is, I'm doing this math class, this algebra class that I need, and I don't understand, but I'm not able to be, face to face because I'm quarantined. So just consider that. How will you address that? I know students get support per their ARD, but if I don't understand, how are you going to assist me with that understanding? I mean, if I'm a student who is a visual learner and you just hand me something and I'm like, oh, wow, I don't understand that. Like, just consider that. There's so many things I can ramble off, but just consider that, how do you plan to meet the need of a student who receives supports or just don't understand whatever the assignment or class is or whatever the case? Just consider that. 2 more questions for real, 2 more. So my second to last question is, will there be any outdoor classroom options? And if so, I know, and I'm gonna put this on with lunch too. How can you assign seating for middle and high school in the cafeteria? So outdoor options and assign seating, if I heard that correctly, in the cafeteria. How does that work?
So we will leverage the outdoor classroom opportunities. We'll continue to do that the same way we did this past year. We also have the filters that are going to be provided for each classroom. In terms of the seating, it is just that we are working to, again, pod those students in the groups where we can easily perform contact tracing. But during the lunchtime, we want to leverage the outdoor opportunities to have lunch wherever possible. But if you happen to be in the cafeteria, then we are going to have a process for making sure that as students enter that cafeteria, that we pretty much seat them in the same general seating area daily. And yes, I know that goes against the social norms for middle school and high school, but given where we are with regard to safety, is absolutely a step that we're going to take to make sure that we can effectively contact trace.
And I do just want to add that the outdoor spaces, we are very fortunate that our district has the majority of our schools, particularly our secondary schools, do have a lot of outdoor spaces. There are a lot of like breezeways and almost like atriums within going from buildings to buildings. And so we're going to continue to ensure that we have the appropriate furniture throughout those areas so that we can use those. As long as weather permits, we will be utilizing those outdoor spaces as a primary area. whenever they are indoor, we also have the additional plexiglass that is also utilized with students in any type of eating kind of arrangement. We were utilizing and we will continue to use those dividers to help us with that as well.
So for real, for real, I have one more question after this, for real, not to be it. Okay, so rapid testing. How will you handle if a campus only has a part-time nurse who is split between two campuses? I know you want to encourage rapid testing, but how will you handle that if a nurse is split between two campuses?
Ms. Copeland did deal with that this past year, so I know she's got her plan.
Yes, so all of our campuses next year will have full-time staffing by a health room staff person. So that's either a registered nurse or a clinical assistant. Both can do rapid testing. If there's ever a situation where there is not a staff person available or they have an accommodation, which is maybe one or two, then we do sign them up for a rapid test at a nearby campus, and they can do drive-through testing there. Or they can even come to central office and someone from my team can do rapid testing on them as well.
Perfect, for real, last question, for real. Dr. Elizalde, can you talk about extended learning opportunities? And please correct me if I'm wrong, extended learning opportunities as it relates to students who are receiving services, is that our committee decision?
Yes, ma'am, from the perspective of how it aligns to the student's individual education plan. From that vantage point, it is an our decision. Ms. Casas, can you add to the specifics with regard to, I think there's just a general concern with how we can meet more. It's clear to me that we are hearing from this particular situation just a longstanding concern with individuals who may feel that their children need that and haven't been able to have that option. I know we were looking at expanding that. Ms. Casas?
That's correct. So campuses are going to have revision ARDs at the beginning of the year to address two things. And the first one is if they are a student in a STAR tested grade and they did not pass or did not take the assessment, they have to address the accelerated learning and the tutoring. And then for students who require compensatory services, either because they had delayed evaluation or other things that might have played in, then compensatory services will need to be addressed at the beginning of the year. And those will be provided either through extended day, Saturday, or other opportunities to meet the needs of the students.
So the one piece that I hear missing is mental health. Mental health, like that should be a big piece of anything that we do. We are still in a pandemic, and we talking about tutoring and all of that. Just thinking about that kicks my anxiety up. So I want us to keep that in mind. That should be front and center as we talk about tutoring, and just making sure that people know that that is an option, even to our staff. That is an option, because this is wow. Thank you.
Thank you, Trustee Anderson. Trustees, other questions? Trustee Zapata.
Okay, thank you. Thank you for all this information. So I was trying to organize this, but I keep getting out of order. So I know for Ms. Meyer, you mentioned, I was just having a question regarding all our school nurses are essential nurses, right? So I'm curious, are all our nurses in our schools vaccinated?
So the majority of our health room staff are vaccinated, but we do not ask for that vaccine documentation or ask for that from them.
Okay. Okay, and I guess I would probably, I'm not sure if that's the same for us, Mr. Mays. You said 100% were offered, all the entire staff of the district were offered vaccinations, at 100% were offered. What is the percentage that have been vaccinated? Do you have that information?
We're just beginning to gather that information because, of course, over time, more individuals have been, have maybe decided to get it when previously they had not. So we are, human capital is working to get that information. I do want to remind everyone that, again, currently with the governor's orders, I can only ask. That is all we can do is ask. We cannot do any further information with regard to why didn't they, or, those are not conversations that we've had. But Ms. Stevens is, in fact, her team is working so that we could gather to answer that question, Trustee Zapata, to be able to say, 50%, 60%, 80%. So we're working on that currently.
Well, especially I'm concerned about the areas that are very high, like Dove Springs, just the concern for staff as well. So the charts that showed the high number of people still unvaccinated in my neighborhood, my district. So I'm just interested in making sure our staff are also safe. So, and then there was a question about earlier in the calls about why not having lunch in the classrooms. And I know before COVID, we were doing that just because it really increased students eating breakfast and lunch. And so is that also an option for schools?
Trustee Zapata, yes, ma'am, that is an option where feasible. All of the options that we have to keep students safe or to safely allow students to eat lunch are options that we're going to be taking advantage of.
Okay, and then I just want to get clarity on, I think Ms. Myers suggested a great idea about what some districts are doing is weekly testing. And is that something we're thinking about to do? I think that's a great way to stay on top of this.
We have had those opportunities. We just have to remember that we can't make anyone take the test either. That's still optional, but I know that Ms. Copeland and her team, especially in those areas like the 78744, last school year even utilized, again, the data of where there were more cases to encourage that testing. And so I know as we continue to get the rapid tests, Ms. Copeland and her team do offer that, and we'll continue to see how we can communicate and encourage people on certain days of the week that we can offer that testing. Are there any more specifics, Ms. Copeland, that you could add?
No, I think you covered it all. Thank you.
Okay, thank you. That's all I have. Appreciate it.
Thank you, Trustee Zapata. Trustee Lulu?
All right. Thank you all for putting this information together and sharing it with the public. And thank you, Dr. Reach, for clarifying that the materials are now available on board docs. So I'll start off with some questions for Dr. Iyer and Myers. Could one or either of you, both of you, speak to what some of the research is showing in terms of long-term effects of COVID?
So I can talk a little about that. So what we have seen, so at Dell Children's, we have a couple of our physicians who are involved in some long-term research studies. So the most one that we are seeing is cardiac effects. So there is something called as MISD. So a child has COVID infection, has got over that infection, and post-COVID infection, they can develop a condition. It's a multi-inflammatory systemic complication. So basically it's the blood vessels in your heart can get affected. So you can have long-term cardiac complications. So we treat them when they're hospitalized. And after discharge, they acutely follow with the cardiologist and the pediatrician or family practitioners and outpatient. And you need the cardiologist's clearance and further testing before we send these kids back into exercise. So that's the one long-term complication we're studying and following at this point. We continue to see these patients once they get admitted to the hospital with COVID or with MISC, even with the infectious disease doctor. We don't have any other data right now, but there's a lot of studies and research going on with it right now.
And then some follow-up questions around the information. So again, I appreciate that the presentation is available on board docs, but I would like to request that the school district put together some easily, like just at a glance information that can be shared with campuses and families about, I really liked Dr. Meyer's phrase, the culture of caution, wearing masks. What we do now can make sure that we have a safer and easier school year. I mean, really, making sure that we've done everything we can to communicate that positive message. Never, Texas is an interesting state, right? Folks like to talk about individualism and freedom. I think one of the costs of having freedom is that we also look out for each other. So to the extent that we can message effectively and easily to our families and teachers and students around these issues, I would really like to see the district do that. And then the other thing would be, so when looking at, so this is a question. So when looking at the science and what research has said or findings, what would the best practice be when it comes to quarantining vaccinated individuals? So I'm fully vaccinated, right? So say I find out that yesterday I was exposed to somebody who, or 2 days ago, I was exposed to somebody and they just found out that they're COVID positive. What would the best practice be for me to do, even though I'm fully vaccinated?
That's a great question and a really difficult question to answer at this point in time. So I believe somebody from the school mentioned that the CDC right now doesn't recommend any sort of extensive quarantine period for people who are vaccinated. However, we are learning day by day about the behavior of this Delta variant, and there seems to be emerging evidence that individuals who are vaccinated are having mildly symptomatic or asymptomatic infections, maybe at a higher rate than we earlier thought. And so I think the CDC does a great job of keeping up with the latest science and trying to provide policy guidance and best practices as they learn more. And I would just say, I think this is going to be sort of a moving guidance as we see these surges happen around the country, as we learn more about the variant. And I would just stay tuned, see what the authorities are recommending. And just in general, the higher the prevalence of COVID is in a community, the more cautious we should be, right? It just means that every time you go out, you're more likely to encounter somebody who could be infectious. And so it makes sense to sort of err on the side of caution when things are looking more risky in the community.
Thank you. And then a question for AISD. So Dr. Lizalde, I appreciate that you use the term, you all are on a swivel. I think families and teachers have certainly felt that as we all prepare to begin this new school year and really on the edge of the unknown. And so building off of what Dr. Myers just said about, as the Delta variant or, even the Lambda variant or whatever COVID and the pandemic and, whatever may come in to us in the coming months, what system, what process do you have in place to ensure that there is going to be a continual review of protocol and, looking at where are those tweaks? And I think back to Trustee Anderson's question about, assigned seating on the bus or assigned seating in the cafeteria. What's the plan to continue looking at how to improve those protocols?
So currently we will, as we have throughout last year, we'll continue to have a debriefing at our executive leadership team on Mondays. Ms. Copeland presented every Monday to the entire group so that we could capture the data that would allow everyone on the executive leadership team who touch all parts of our district so that we can continue to then gather feedback from those individuals as we're reviewing data simultaneously. And as we need to make adjustments, we work to do that collectively. So our plan would be to continue. We might have thought we might not have had to do that this coming school year up until about 3 weeks ago when all of our data, right, started to change. So we will continue doing our weekly debriefs. And then whenever there is like an uptick at a particular place, if we don't wait for a Monday, Ms. Copeland would immediately notify us. That's why I think even though the Texas Education Agency is no longer requiring the COVID dashboard, we're going to continue it because it helps us to identify where we're starting to see some concerns, and that way we can address it, not waiting for a Monday meeting. But we will have a regular cadence of Monday debriefings. I'd also just want to add to the, I guess maybe 3 things that I'd like to add at this point. One is Ms. Copeland and her team really do a great job of anyone, even if they're vaccinated or even if they're vaccinated, if they were in close contact, we offer them the test so that if they want to get a rapid test. But we also know that you almost have to wait sometimes up to day 7 before you're actually going to know if it's a true negative based on the information we've received. That's an area we'll probably be increasing, as Dr. Myers mentioned, and that came from us listening to the Big 5 group that is held here in Austin that I get to just listen in on, and knowing that there are changes with this Delta variant, we will begin to encourage and offer testing to those that are vaccinated, that have been in close contact, but may be asymptomatic. Because that is, as Dr. Myers has shared with us, that is one of the ways we can find out if we have some transmission that may be possibly occurring through vaccinated individuals. So we'll continue to learn from them and move forward with that. I also just want to take a moment. I know Trustee Boswell asked this question, but it's kind of swirling in my head. I want to make sure, popular or unpopular with some folks that may have different perspectives, I want to make it very clear that the concern and the push for masking, that's coming from me in terms of keeping safe, all of our folks safe on our campuses. I don't want our staff, our teachers, our custodians, our bus drivers or teacher assistants, or for any community or parents to think that this is coming from them and that they are putting pressure on me or on Dr. Mays or on any of the other leadership team members. This is coming from review of data, review of science, review of information, of visiting with people like Dr. Myers and hearing from Dr. Iyer and understanding the science behind that. And so our teachers, our staff, our principals, all of our staff, and anyone I'm leaving out, counselors, they have done a phenomenal job, and they need our communities to support them through this next school year. This has been a very, very difficult year. They were looking forward to a normal return. And I just want to reflect on the fact that there might have been some folks that are of the opinion that this is in response to union demands. This has nothing to do, it has everything to do with safety. And I'm fortunate to work for a board of trustees as you all, who constantly ensure that safety and health is at the forefront of our conversations. So I did want to make sure I said that. And lastly, because we are bringing virtual as an option, I do want to make sure we don't know exactly how many students we would be able to serve based on the number of dollars that would cost and its connection to jobs. So we will be sending out a survey and it's going to be going out really quickly. It's going out tomorrow. And we really want all of our families to please respond, to help us, to help our staff plan so that we do give teachers and principals and counselors and custodians and TAs, everyone an opportunity to plan for whatever we might be able to do in terms of our goal being able to offer and meet everyone's needs.
Thank you. And yeah, I think I am joined by many families and other folks who appreciate that the district is looking at how to make virtual instruction possible to whatever number of students we can actually do that for. So I have a request and then 2 more questions. So my request is to the board president. I ask that the board work with the district to decide what kind of messaging the school board as a body can support and put out there so that it's clear that our school board supports using science and facts and data, and that the best thing about working with the public is that we think about each other and we care for each other. And a small thing as wearing a mask, for those of us who can do it, I would really like to see us have that type of messaging. And same with vaccination. I think this is an opportunity for us to use our voice as a body, as a board. So that's my request. And then the other 2 comments are, so Dr. Elizalde, could you share with us kind of when you, let me preface this by saying, like, I think, you know, sometimes people read headlines and it's like, oh my gosh, you know, such and such district is providing, you know, so-and-so. And then, you know, when you click on the link and look deeper, when you start to do a little bit more research, you know, come to find out that, you know, the headline didn't quite capture everything, right? And I know, you know, there's lots of kind of learning from each other as we go through this pandemic. So could you share some of the things that that you think AISD is doing as far as COVID protocols that that you feel kind of sets our district apart, and then also share with us what are some learnings, what are some things that you're seeing that you're like, okay, well maybe we should consider doing XYZ just like, you know, such and such district, or, you know, can you share some of that with us?
Yes, ma'am. Thank you, Trustee Lugo. Let me start maybe in reverse order and go with the virtual instruction model and what we learned thus far. Leander is about 40,000 students, a little more than half our size, and they're going to serve 350 students, 350. So that is less than 1% of their population. Round Rock has not given a number. I know that's partly the same reason I don't want to give a number, because we want to see first, because if we can meet everybody's need, I don't want to set some arbitrary number and then there's like, you know, 100 more parents and we could serve those. Well, then we want to serve those. So I don't want to put an arbitrary number out there. What we're learning is everybody's context financially is different. So for instance, in Round Rock, they have an extremely healthy fund balance. And so what I'm learning from that is they're actually going to use their fund balance, not ESSER dollars, to supplement the losses that they're going to take because of offering virtual instruction, but they don't know how many yet that's going to be with. So that did generate conversations for us about, well, if neighboring districts are doing it, how are they doing it and how can we do that? So I think that was one of the learnings, is getting with other districts and trying to problem solve how they may be problem solving. Because if somebody else is doing it, then absolutely we want to know, well, if they can do it, can we do it? Some of our things that I think are going to separate us is, I want to reiterate we will have individual classroom air purifiers in addition to those HEPA filters. And I did see some, well, a HEPA filter doesn't tell me if it's a MERV 13 or a MERV 14. And now I promise you, I do not know anything about those things. Mr. Segura is the expert, so I don't even know if I used the wrong number. But there are some constraints because some of it has to do with how much airflow goes through. So just saying we're going to put that MERV number in every single one may actually do the opposite of what you want. You want to filter, but you don't want to restrict circulation. And so it's a balance based on what units that we actually have available, which is why we have added individual classroom purifiers in every single classroom, not in some, in every single classroom. We have 5,400 teachers. We will have 5,400 individual classroom purifiers. In addition to that, we are one of the few districts that will continue to do the contact tracing. I just got off the phone, off of a Zoom call with Central Texas superintendents. They are not going to do the contact tracing the same way we've done it throughout this school year. They are going to go with just what's required. They'll send out a note to the classroom that says someone in the classroom is positive. That's not what we do. We not only say someone in the classroom, we say, and these individual students, and we make individual phone calls. That is something that we're fortunate because again, Alexandra Copeland and her team, we have dedicated health professionals that do that work for us. We also will continue to ensure that we are maintaining the use of our outdoor spaces. Our buildings are not like many other places that everything is in one building. We have separate buildings, as I mentioned earlier. Utilizing those outdoor spaces is critical, both not just from when you're going to be eating, but from just an activity standpoint. I know we've had some parents that have already have great ideas. Ms. Casas' team is going to connect with some of those. There's no reason to reinvent some of the things. We got some fantastic plans from some of our parents. We want to continue to leverage that. We're going to continue to post and be transparent about the data that we have because we think that's also very important. So again, communicating that, keeping it out front, contacting individuals, and ensuring that we have the multi-layered approach. And we're going to continue to offer the vaccinations throughout sectors of our city, but particularly the Eastern Crescent, because we know those are the areas. And someone may say, well, you only gave 100 vaccines on one Saturday. That's 100 more folks. And we are very content with doing 100, 1,000 times if that's what's necessary. But we also know it's going to take some education and communication and relationship building for those who are hesitant to take the vaccine. And so we think we also need to embark on helping our city and our county with communicating why it is so important to get the vaccinations. I'm sure there's more, Trustee Lugo, that the team is doing, but I think I've hit the high points, unless there's something in specific you'd like me to touch on.
No, that was great. And I appreciate that last comment about working with the county and city around messaging. So I, again, would also encourage that the board look for ways to join in that communication. Thank you, Dr. Elizalde.
Thank you, Trustee Lugo. Trustee Singh and then Trustee Wagner. Arthur, you're on mute.
I think I know by now. Thank you so much for this excellent information. I have some questions for Dr. Myers and Dr. Iyer. So can you please share what % of new cases recently and hospitalizations in Austin are for unvaccinated children under 12?
I don't have that information specifically. I can provide numbers of hospitalizations that have been under 12, but I don't know whether or not, under 12 would be unvaccinated, but I don't know for over 12 whether they would be vaccinated.
So all our patients, adult children, they are unvaccinated. All our pediatric population, none of them had got the vaccine. So we did not have any vaccinated pediatric patients admitted at Dell.
So I guess I should clarify. So I would say out of all the recent new cases in Austin, adults, children, everyone, I'm trying to get a sense of what percentage of those were for children under 12, who we all know have been unvaccinated. So, you know, is it 1%? Is it 10%? You know, how many of these cases are children?
Oh, so you're asking out of the total COVID patients admitted,
yeah,
of them is pediatrics.
Yeah.
It's a very, very low, small percentage. It's, I would say, less than 1%. It's very less than that.
Yeah, I can tell you that in the hospitalization data that we've seen for the city over the past 30 days, about 2.2% of new admissions were children under age 12.
Okay. 2.2% of new admissions. And what was it in the last 3 days?
30.
Oh, 30. Okay, great. And then how do you, what's the trajectory for that once school reopens?
We don't have a specific projection for that at this time.
Okay. Is that something that it would be possible to get, or is that just kind of based on so many different variables?
So, you know, with these kinds of requests, and the city has and other decision makers have asked us to make these kinds of forecasts, you know, thinking that far ahead about something that's going to fundamentally depend on behavior and policy, you know, we can't possibly forecast that, but we can make some scenario projections. You know, for example, we could project if schools amplify transmission by a certain amount, what would that translate to in terms of pediatric hospitalizations? But we haven't made those kinds of projections. It's something we could do and be open to discussing it.
Thank you. Also wanted to ask, I guess what I'm getting at is, you know, during the last school year from September 2020 through July 15th of this year, so September last year through July 15th of this year, we had 1,402 COVID cases in our district, 656 students and 719 employees, 27 other. I'm trying to just get a sense of, are we expected to see more in the upcoming school year or less? Or if it's more, is it going to be like a lot more or a little bit more? Highly technical terms.
I mean, again, it's like we have no crystal ball about what the behavior will be. If we go into the school year with the prevalence that we have now, and schools or individuals do not take precautions to prevent transmission, we will likely have introductions and we'll likely see more cases than we did last year, because we'll have more kids in the same place and we'll have less precautions. So, you know, that's sort of the worst case scenario. If we go into the school year and by the time school starts, we've really brought transmission under control in the Austin area, and individual students and families voluntarily comply with the recommendations, including face masks and staying home if they have symptoms or they think they have exposure, then, you know, we could be in a very good situation and things may not look significantly worse than last year.
Okay, I appreciate that. Also looking at, I appreciate Dr. Elizalde that you said you're still going to be tracking and having the COVID dashboard. It looks like, I took a glance at it the other day and it looks like that we are experiencing kind of a spike right now in our central office staff. Is that correct? Is this can you please share a little bit about, like, are we like at the peak, or can you compare it to another point in time, just to kind of give us some sense of perspective?
Sure, absolutely. I'm going to let Ms. Copeland kind of address it, because I sometimes make some statements when I see because, you know, I get notified every single case. I get notified on my phone instantaneously as soon as that's reported and confirmed. So I don't want to not have aggregated the data correctly. So I'm going to let Ms. Copeland address that question. Ms. Copeland?
Yes, absolutely. So since June 9th, when we started our summer schooling, we've had 28 cases. 17 positives were staff, 10 of those were students, and one was other. Initial transmission for the cases occurred outside of the district. We have had several cases at the central office level. None of those were related, and there was no transmission within central office. So I do want to confirm that.
That's great to hear. Thank you. I am really curious. One of my favorite slides, I even took a picture of it from Dr. Myers' presentation, was the one about, I think it was looking ahead. And see if I can pull it up. You had said that we want to make sure that we, some of the precautions you listed, I think at the very least are ones that I would like to get more data on. One of them was regarding to, grouping the students or keeping them in pods wherever possible. And I kind of think about lunchtime. Again, I'm going to bring that up. And I appreciate that Dr. Mays and others said that we would allow the students outdoors if possible. It sounds like we are committed to keeping them together for contact tracing purposes. I always get a little worried when I hear when feasible, because that's kind of sometimes when the inequities can seep in. And so I would really like to get actually exact numbers, like which campuses are going to have outdoor breakfast and lunch, which campuses are not, and kind of try, compare that data to those color maps that Dr. Myers had, and make sure that, where we have the most cases of COVID and where we have the lowest vaccination rates, we have to have outdoor cafeterias there. Like, to me, that's not even a question. So, if the governor's not letting us do masks and we're having to pay out of our pocket for virtual, and a lot of our families do want their students to go to school. And that's fine too, but we really do need to make sure that they are getting, it's going to I feel like it's just going to undo everything if we allow them to have lunch together in the cafeteria. So that's that. So would it be possible for us to kind of just get like an actual tally, like a list of each campus and which campuses are going to have outdoor cafeterias and which ones don't? And I think parents need to be aware of that as well.
Yes, we can certainly work on that. And the reason we use as when feasible is, as you all know, if we do have a shortage of staff for any reason, that could also impact just where the spaces are in terms of how many smaller groups we have. This is a very fine needle we're trying to thread, because our teachers need their own time. And so in order to have all the students in small spaces, which is why breakfast is something that is more feasible, because we can do that in the morning. But our teachers also need that time to be able to go have a duty-free lunch. And so, we balance it all out. And some campuses are going to be able to do that in a better way, just based on the number of staff that are out on a particular day versus others. But our intent and our commitment will be to always do as much of that as possible. I do want to just reiterate that we did have students eating in the cafeteria last year in groups that we had identified with seating charts, with plexiglass, and we did not see any outbreaks from that. So we're also not doing this totally blind, but of course we recognize that there is a new variable just with regard to the variant. So I didn't mean to use two V related words there, but because the variant is changing that. So we'll be super hyper vigilant on ensuring that anytime that we can do that, but we can certainly create a listing of schools and where they would have all of the variety of places that they will be able to utilize to ensure that we do the very best that we can.
I appreciate that. And I really appreciate having that information public, because I think parents really need to know. And I think if we talk about equity, like this is when it happens, like you mentioned, staffing. Well, it is those same purple zip codes where we have where we have the hardest time finding substitutes, where we have the hardest time sometimes finding volunteers to cover classes. So that I do just want to, at least from my perspective, you know, if we have teacher shortages or whatever, and in those classes, in those campuses, then let's get some teachers over there. You know, I'm sorry, that's just my little soapbox. But I do feel very strongly about it. Related to that, again, under the umbrella of, are we doing everything we can within the limits that are placed on us? And is that information out there for parents to see how safe their kid's school is? I would love to see what percentage, again, campus, like, where do we have schools with classrooms with the windows that open? You know, there's a CDC study that the Austin Public Health has cited several times, saying that does have a huge impact. So I don't know. I would love to know about my kid's school and about any other, if any parent asks me about it or brings that to me, I would love to be able to go to some source or have the staff go to some source and say, okay, well, half of our classrooms have windows that open. I do think that it seems like a small detail, but it seems like it could make a difference. Another question that, honestly, I've been asking this for months. I don't think I have it yet, is a list of campuses that have centralized, and I don't know the technology, but my understanding is if you have the MERV 13 or higher HVAC system, that's good. You know, I've heard the term hospital grade, and when I've asked staff, well, which of our campuses have the hospital grade centralized HVAC systems and which don't, I still haven't gotten an answer to that. And I think that our parents want to know if their kid's school has that. And if it doesn't, I know that we're putting things in place, like in every classroom, we're having an HVAC, a fan or something with like a HEPA filter. That's awesome. But I think that's something that I would like to get educated on. I think our community needs to be educated on. And if we don't have a MERV 13 HVAC system, that might not be the end, you know, that might not spell doomsday, but at least we need to understand what that means, because right now I don't think we're educated. And I have parents been asking me about this for months, and would love to get just, again, a list. Campuses, what exactly they have. Is that something that would be possible for us to have?
Absolutely. My apologies.
Thank you.
It's been months that you haven't had it. We will make sure that we get that to you.
I appreciate that. I know that we can't require masks, obviously. Can we require that our teachers teach kind of a standardized, developmentally appropriate lesson to kids about how COVID spreads and how masks are effective in stopping the spread? It's part of that whole culture of wearing mask things.
I don't think that there's anything that precludes us, unless that gets added to the new civics bill. I don't think there's anything that precludes us. That was a little bit of a joke to our critical race theory. I don't think there's anything that precludes us from that. I do know that we had embedded the first 9 days of the school curriculum to include a heavy focus on social, emotional well-being, mental health. It was a written curriculum that the entire our staff had created so that teachers wouldn't have to go looking for resources. So I can certainly see a benefit to providing that across the board. And I know that our team can embed that within that. So we'll definitely go back and connect with our team and put that together. I'll have a conversation with them with regard to that.
Awesome. And then I'm sure you've been hearing from parents who requested, can we have classrooms that are like separate classrooms for masked versus unmasked students?
Yeah. You know, that's a very fine line because at the end, they're all our children. And I think we really need to have a visit internally when that was originally discussed. Dr. Hawley, I don't know if you're on here with us. I know we had a lot of conversations about what that does in terms of creating some additional inequities as we move forward, separating out masked from unmasked. Dr. Hawley, I don't know if you wanted to add anything from when we had that brief conversation.
Yes, Dr. Elizalde, I think you covered it well. Segregating kids and just stigmatizing children for whatever reason. There's not a lot we don't have any research to support that's going to be helpful to the children. It's already been a traumatizing year. And to separate them and segregate them based on their family's choice for them, we don't think that's productive or useful.
Thank you. I would love for that response to be placed in the FAQ file, because I get that question a lot from people, and I'd love to be able to just refer to that. Some other questions are regarding safety protocols for athletes in high-risk sports. You don't have to answer these now, but I just to put on your radar for when you actually do come up with the Open for Learning plan, would love to kind of get some more information on how that's going to happen. Would also love to see, if an unvaccinated child is exposed to COVID and doesn't have childcare at home, is there some way that the district can help? Is that something somewhere, anywhere in our plans? Because that is something that we have heard a lot about from parents. I did have a few others. One was when we talked about a virtual option for K through 6. Thank you. That's awesome to hear. Really appreciate that. The district is looking at how to make that possible. Wanted to clarify that it would not include pre-K. It is just literally kindergarten through 6. Is that right?
Ms. Casas, can you address that question? You all had that conversation about, I think, something about which part is compulsory attendance. Dr. Mays?
The focus is on K through 6. And so we have been going back and forth, but we landed on K through 6 based on some of the feedback that we've been able to collect from families and discussions amongst the team.
Thank you. Also wanted to there was a mention of proactive testing of every student and staff. Again, thinking about those zip codes where we have the highest rate of unvaccinated people, I would love to see something like that taking place that we just do by default, as long as parents approve of it, because that helps. And it will help address the silent infections that I think Dr. Myers mentioned. Is there any way to actually measure the air purity in a building? And if so, is that something that's part of our plan?
I see Mr. Segura there, and I'll let him address it. Just in general, I think the scope here has to be, what are we measuring specifically for? In other words, we can measure, we can't identify COVID particles in the air.
No. And
so, yes, we can assess certain things in the air quality, but we also I also have to be cognizant of there are limitations with regard to who would be doing that, how many times, which classrooms. Is it upon request? Is it, I think there are a number of things. I think we have to continue to keep in mind the scale and the size of what we have. Mr. Segura, can you add? I know you've done some of this kind of work before.
Absolutely. First of all, can everybody hear me okay? All right, well, thank you for the opportunity. My name is Matias Segura. I am the Chief of Operations. And I can certainly speak to our protocols around testing indoor air quality. So right now we use, a system that really kind of uses our controls. So, right, so we're testing air quality, airflow over the larger HVAC system. And so each of our facilities has a control system, and we use that system to determine how the HVAC system is operating. Again, that's climate, that's filtration. And if we have the proper indoor air pressures, we know that it's performing at a very high level. But when it comes to actual testing, that is a very expensive process. We do it whenever there is a known or identified concern. Examples of this have occurred in the past at Burnett Middle School, certainly over the last several months and year, a time or two when a concern came up and it was validated based on information that we had from our internal systems. We went ahead and procured a third-party consultant to perform an air quality assessment. But it is very costly. And so we try to use our systems to really understand how everything is performing in lieu of discrete testing, because per space, it can be between $8,000 and $12,000. Thank you.
Thank you. Appreciate that. I have, of course, some questions about the STAR test, but I think I'm petered out and you guys are probably tired of my questions. So I'll save those for August when we talk about the STAR test. But again, thank you so much. Thank you to the staff for working your tails off over the weekend to put all this excellent information together.
Thank you, Trustee Singh. Trustee Wagner?
Good evening. I appreciate the presentation tonight, and I have really just kind of one question, or hopefully a little cluster of questions, and that is around the timing of the virtual rollout and notifications. I recognize that you guys are working as fast as you possibly can, but I also know too that it sounds like families would not